This video is for all the people out there who are anxious or nervous when it comes to dentist. For all the people who avoid going to dentist due to fear. You might have needle phobia. You might have previous bad experiences, or sometimes there's no particular reason for it and you're just afraid of the whole thing when it comes to dentistry. Firstly, I want to tell you, please don't be embarrassed, because a lot of people are out there like you, and fear of dentistry is actually very common. We are here to help you. We're not here to judge you. The issue is when you avoid going to dentist, you end up with more problems, bigger problems. And bigger problems means more major treatment, more trauma. Like if you leave a sensitive tooth for too long, you may end up needing an extraction. And an extraction is a far more traumatic experience comparing to a small filling. I should say the technology has changed. The equipment, the material that we use these days are far less uncomfortable comparing what they used to be. Even the attitude of the dental team has changed towards anxious and fearful patients. These days, we get a lot of training in dealing with people who are not comfortable in coming to dentist. Saying all that, you just need to make the first move. The first session usually is a consultation only. We have a chat to you, we get to know you, we get to know your fears, and then if you feel comfortable, we're gonna do an examination of your mouth and we'll figure out what's needed to be done. Then we're gonna discuss the options you have for reducing your anxiety. There's a TV on the roof, and while you're lying back, you can watch something, and it's a very good distraction. You can always bring your own music video and listen through earphones, or we can provide you with some calming music and earphones. We can administer happy gas for you. Happy gas calms you down and higher the pain threshold. It's a very safe gas, and the best thing about it is that at the end of the treatment you can just go back to your routine daily life. You can even drive. We can always prescribe you some sedatives to have the night before and the day that you come here for treatment. It's another effective way of calming you down. Also, IV sedation or twilight sedation is available as well. A medical doctor will put some sedatives into your bloodstream and you're going to be very, very relaxed, and you're not going to remember much afterwards. It is less traumatic than general anesthesia for the body. You're going to be awake, but as the name says, you're going to be in and out. You need to have the next day off to rest, and also at the end of the procedure someone has to drive you home.